Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hey, good morning, everybody. Happy Labor Day weekend. We're coming to you from West Los Angeles. This is Living Pain-Free. Dr. Darrow's away from us here this weekend, but we are excited to talk to you about healing your orthopedic injuries, your musculoskeletal issues, using something called regenerative medicine. That's where we use things like platelets, PRP, which is platelet-rich plasma, and stem cells to heal the body instead of doing surgery on these issues, which is pretty neat. So we can use the benefit of using these injection techniques instead of surgery. Much shorter downtime, much less complication risk, and again, we're healing tissue instead of doing further damage with the surgery. Would love to talk with you live here in the studio. You can give us a call. Our number to talk to us live, 866-870-5752. That's 866-870-5752. Give us a call. We'd love to give you a copy of Dr. Darrow's book. It is fantastic. Great place to start to learn about regenerative medicine. Lots of great studies. I think we have close to 300 studies in that book. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Love the title of that book. Again, we'd rather heal that tissue up rather than doing surgery, which again comes with its own complication risks, much longer downtime, physical therapy, time away from work. And again, a much more natural way to heal the body is using injection therapy, which is a pretty amazing thing that we can do nowadays using the benefit of musculoskeletal ultrasound, which we'll talk about here in a moment. And again, if you want to get a consult with our staff for free over the phone, not with us, but with our staff, that number to call is 800-300-9300. Again, that's 800-300-9300. We also have a fantastic website. Please check it out. Lots of great videos of us actually doing these procedures. Take the fear out of what these injections actually look like. They're very quick. Again, use really small needles because we can use musculoskeletal ultrasound. It's like a kind of a real-time look at what that tissue looks like. We can guide that needle directly where we need to place it. Lots of great studies as well on that website. That's called www.jointrehab.com. That's www.jointrehab.com. Lots of great studies, spot on every page now to email us. We just had a pretty fun review come through Google talking about a gentleman who had an injury. We got to him within 24 hours and actually got him treatment. So we really pride ourselves on being available. It's a big frustration we have in the medical system. I don't know if you've ever, had a tough time getting in with a specialist, right? Or maybe you get an imaging test done, or you get some labs done, and then you can't get a hold of your physician. It's really hard to see him. And then when you do get in to see your provider, they're kind of rushed to that appointment, right? They've got to see a ton of patients every single day. It's a huge benefit that we have. One of my favorite parts about my job that I have is I get to spend all the time in the world with a patient. I got to make sure that they're in a good position to understand what's going on. I can lay out their treatment options, whether that's to go with injections with us or not, making sure we're getting our questions answered, going through your imaging. And again, the benefit too of using musculoskeletal ultrasound now in the clinic. Tons and tons of training, over a decade of scanning people, cadaver work, learning how to do these injections by the best minds and hands on planet Earth. I've done around the world trying to find the best techniques, the best mentors to learn from, Dr. Darrow included. making sure that we can give you the best possible care and treatment. The benefit of using ultrasound now is it's non-radiating, meaning I don't have to use x-rays, right? So if you ever had an x-ray or fluoroscopy, CTs, it can be a lot of radiation. In addition to that, it's right there in the clinic, so I don't have to send you out. I can actually sit you down, put the ultrasound directly on that area that's injured, and use that as another piece of information to try to diagnose what I think your problem is. So a huge challenge in the musculoskeletal world is trying to line up the pathology, right? The stuff that we see on imaging that's not completely normal with what the reality is, right? What is the actual cause of your pain? So we say that pretty frequently around the office. What's the pathology versus the reality? We just think it's very incomplete to make a judgment based off of just what the image says. So you got to make sure that you're getting somebody to put their hands on you, making sure you're stressing those tissues, making sure that we're validating where we think that pain is coming from. So you might be thinking, like, why is that a big deal? Why can't we just go off of imaging? Well, it's a really big deal because if you end up having an invasive surgery, right? God forbid you had a joint replacement when the cause of your pain wasn't your joint. So in our minds, that's a really big deal, right? So the things like joint replacements come with their own complication risk, right? You've got anesthesia, right? Some people, unfortunately, just don't wake up from that, or they get, long-term brain fog. Proper anesthesia too. Some of these high doses can have their own side effects in terms of just being down, right? You think about things like blood clots, right? Things like a DVT, that's a deep vein thrombosis. That's where you get a clot in one of your vessels. That can lead to something called a PE, or a pulmonary embolism. That's where the clot travels to the lung. That's a really big deal. And then God forbid it got into your brain, right? That's where we call stroke. So those are very real complication risks of having surgery. And again, every week we talk about surgery and then the dangers of it. At the end of the day, though, some people do need surgery. We certainly do refer out. It's just not very often. But when we do think it's appropriate, we don't throw any bad energy towards surgeons. We're very, very thankful that we have these amazing individuals that can provide very good care. It's extremely challenging. I did a lot of surgery through my training all over the country. In the operating rooms, I have the utmost respect. It's a very challenging, tall order to do a surgery, not have a complication risk. So pretty amazing that the complication risks are low, but again, they're real, right? So we'd much rather go the conservative route, right? Everyone's got their own biases. We'd much rather go conservative and try to decrease someone's chances of having a bad complication risk. But we can chat a little bit about what do these injections look like for you. So if you come in, certainly you can bring your imaging in, but I'm always going to put that ultrasound on in real time to see what that tissue looks like, today. So if you come into the office and you're having some pain, if you have an MRI a couple years old, you might have a new injury going on. So I don't want to base my clinical judgment off of an old image like that. In addition to that, we're doing a hands-on physical exam. So what does that look like? We're making sure we're putting hands on you, right? We're stressing those tissues out. We're really pinpointing where that pain's coming from. We do things like provocative maneuvers, meaning we're going to try to stress that tissue and put those pieces of information together to give the best care plan, right? From there, we can make a decision whether we want to go with platelets or we can mix in some stem cells with that if you want the fastest healing, in order to try to get you some healing on the tissue level now. So lots of great studies out there looking at before and after, even with the microscope, that we've got new tissue being laid down. If you are looking at things like a joint replacement, right, what's the issue there? Well, you had some arthritis, and arthritis is where you've got some wearing down of the articular cartilage. So when that cartilage gets worn down, you get some nerve endings getting exposed. That's an area that can potentially cause some pain for you. So what we try to do is try to put some cells into this area, right? The healing cells of the body, stem cells and platelets. And we actually show that we can actually regrow some of this cartilage. We can actually downregulate or kind of decrease the amount of these bad inflammatory proteins and these cytokines that are floating around these joint spaces that we think also lead to arthritis. So pretty neat. Also some interesting studies looking at how they slow down the wearing down of that cartilage. So it does a couple of things that we think contribute to getting our patients really good results. But very straightforward. We come in if you want to do PRP, or platelet-rich plasma. We just do a simple blood draw like you're giving a blood test. We take that blood, put it down in a centrifuge, right? So this machine that spins it really fast. We're going to separate out all those blood components, leave behind the red blood cells, take away all the good growth factors and platelets that we think contribute to healing. We put that into a syringe using very small needles, aiming with ultrasound guidance. Pretty neat. I always encourage patients, hey, take a look at the screen. You can actually see the needle going directly into these areas, right? Whether that's going to be a ligament, which attaches a bone to a bone, a tendon, which attaches a muscle to a bone, or any other soft tissue structure. We also inject joints, obviously, but we go head to toe. Very, very happy and very fortunate that I've had some training by some of the best in the world. We were talking about it with some patients this week of, how I got into this whole field, and I'm very, very fortunate. So I was, blessed with some athletic ability, ended up playing football for the University of Nebraska. Go Big Red. Cornhuskers playing, I think, this week. And then from there, it really exposed me to the whole world of, sports science, sports nutrition, sports medicine, psychology, orthopedic surgery. So I was exposed to some really great minds. After that, I got into strength and conditioning. I wanted to dive really deep into the world of, professional sports and human performance, and how do we get people, to lose weight, and, increase the muscle mass that they have, improve their sleep, just overall, improvement in their performance. From there, got some really awesome exposure. So at that point, I'm living with professional athletes, I'm traveling the world, I'm really surrounded by some of the best minds in these fields. And that's when I originally got exposed to regenerative medicine. So I found a couple of my athletes, my clients, had some injuries. From there, they ended up getting some injections, and they were back in action, didn't have to, quit the season, didn't have to have a season-ending surgery. And from there, I was really, really piqued with my interest. I'm like, what the heck is this stuff? I got to learn about this. At the same time, you want to make sure that you're still getting exposure to the other side, right, of sports medicine, which is the operative part, right, orthopedic surgery. So I did a ton of shadowing, ton of assisting. I was very fortunate to match some of the best programs in the country. I was in Pittsburgh and Dallas and then Virginia. It was a really, really awesome experience in the operating rooms, looking what these amazing surgeons can do. And again, certainly sometimes with traumatic situations, broken bones, really gnarly stuff, right? Surgery is 100% needed. But really with the role that we're playing here with regenerative medicine is these elective procedures, right? So maybe you've got an old strain or an old, ligament strain. Maybe you've got some arthritis that you want to get taken care of. And so we're in this elective sort of mode, right? You don't have to have these surgeries. So maybe you want to take a look and see, hey, is there something else that we can do without having to go underneath the knife, right? And regenerative medicine is amazing. We've got lots of great now long-term studies on certain surgical procedures, things like meniscus tears or certain rotator cuff, right, in the shoulder surgeries that we know now some of these long-term outcomes aren't the best, right? Even at the 6-month or the 1-year mark, we find that regenerative medicine can do much better in terms of complication rate, speed to recovery, right? If you're an athlete, obviously, putting some years in your career, getting you back sooner. But we treat every single age. I think in the last couple of weeks, I had like a 15-year-old, and I think I had someone, they were close to 100 or over 100 years old. So again, this stuff works on almost everybody. Age is not a limiting factor. If you're a human and you're walking around on Earth, you are an athlete. Your body is meant to move, right? So we want to make sure we can play a role to getting you back to being active again, right? Holding on to muscle mass, trying to gracefully go through age, making sure we're giving you the best quality of life that we can. Let me give out that phone number again, guys. Love to chat with you here live in the studio. Again, you can give us a call if you're driving. Be safe. Okay, pull over. If you're shy, make sure that you're giving a fake name if you need to. We're friendly over here. Give us a call. Our number live is 866-870-5752. That's 866-870-5752. You can talk to me right now in the studio. We'll give you a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We'll even pay the postage for you, right? If you or a loved one or someone you know might benefit from a non-operative treatment, right? Maybe they're even scheduled for surgery. Make sure you're giving us a call and we'll get you that book, give you some great information there. Again, surgery is not needed 100% of the time. A lot of these elective procedures we think can be handled now with regenerative medicine. So making sure you're at least giving it a look, right? You don't want to make sure that you're getting rushed to a big decision like an invasive surgery. We'd love to get you a call here. You can also get a consultation over the phone with our office staff for free. Okay, that's with our staff over the phone. Now with Dr. Darrow and I, but with our staff, we're at 800-300-9300. That's 800-300-9300. Check out our website, tons of great studies, lots of good videos of us actually doing these procedures. Take the fear out of what these injections look like. Our website here is www.jointrehab.com. That's www.jointrehab.com. Great studies, great videos, great opportunity for you to get some information before you come in, right? Again, don't feel like you're going to be rushed to that first appointment. Every week someone's surprised at how much time we can actually give them in those initial visits, and we want to make sure that we're giving you the best quality care that we can. So that's, again, one of my favorite parts of the job is having the opportunity to communicate, trying to learn who you are, what are you about, what are your goals, what have you done so far, make sure we're doing a proper, thorough medical history, getting you in a position that we can give you the best information, right? We're not trying to tell you what you need to do. We certainly want to encourage you to go the conservative route first, but we want to make sure we're laying out your options, right? We want to make sure that you have the information that you need to make an educated decision and feel good about it, right? There's no guarantees in medicine. I wish that there was. Same thing with surgery, same thing with regenerative medicine. We can't guarantee that someone's going to get a certain result at a certain time. But again, we treat a ton of patients. We got a really busy clinic. We got to help a lot of people. So we want to make sure that we're giving you an opportunity to heal. Anytime anyone's looking to have a procedure done or have a surgery done, I always say, hey man, go to the person who does the most of it. They're going to have the most amount of experience, and they're going to see a whole lot of variations of whatever your symptom is. And that's going to be something that gives you, I think, the best opportunity to heal. So making sure that you're giving your best option to move forward with that. But we've got a lot of great cases to discuss today. First of all, we're going to talk to a patient here. We've got Mark coming to us from Paramount. Mark, good morning. Dr. Thomas Grove here. How are you, sir?
I'm doing just great.
What can we do for you, Mark?
Well, I'm actually a former patient. You guys did the stem cell and PRP on my left shoulder when I tore two of the tendons, the spinatus and the supraspinatus, in my left shoulder.
Oh, fantastic. How are you doing now?
Well, I'm doing great. The shoulder's healed up nicely. The only thing I had to do was some physical therapy on it. The muscles kind of atrophied, and so I did some exercises and built the muscles back up. But other than that, it was a pretty painless and operation to get my shoulder back together.
Yeah, it's pretty surprising, right? You compare it to things like surgery, right? Where it's a long road, it's a pretty invasive process, and you can come in and get injections, right? I mean, how long were you actually, having the injections done? A minute or two, maybe, cleaning you up, getting the injections done, walking out of the clinic?
Yeah, well, it was about an hour to an hour and a half each time I was there. Yeah, I mean, I drove in and I drove out, and it certainly wasn't like having surgery. I had torn the rotator cuff in my right shoulder 10 years earlier and had surgery on that, and that was a year and a half recovery from the surgery to get all the range of motion and all the muscles back, because muscles had atrophied pretty badly when I did that. But what I'm calling about today is actually my left ankle. I had a ski accident a few years back, and my ski binding did not release. So I fell over forward, and I had basically my nose touching the tip of my ski.
Oh, wow.
So my left ankle was pretty stressed out and blew up like a balloon. It took months and months to heal, but it's never been right since then. And I'm not having major trouble with it, but I am having some problem with it. It tires easily, and it swells up every day when I perform normal walking and activity. So I was thinking about coming in and having stem cells or PRP on that.
Yeah, again, like ski accidents can be pretty high velocity injuries. I mean, these can be as much as car accidents, right? So, yeah, fortunately, you didn't have a bunch of broken bones, and you're still functional. Sounds like, but we see a lot of ski accidents where, yeah, that foot kind of gets immobilized, and the whole body kind of decides to go, and the ankle's going to stay put. So a lot of times, what you can get is things like traumatic arthritis, meaning that that high velocity can actually disrupt some of that cartilage. In addition to that, I can't guarantee it, but I'm pretty sure you stretched out some ligaments of that ankle as well. The ligaments around that ankle, there's a lot of them. There's some on the inside, outside, front, and back. Very, very important that we're looking at things like ankle injuries, that you're doing a good hands-on physical exam, just because there's so many structures around that spot. I actually did, I think, about 3 or 4 ankles yesterday. Similar mechanisms. I had someone coming off a curb, someone off a ladder, someone with a tennis injury, and then someone with a ski injury as well. But that can be something that can be very debilitating. When you look at things like biomechanics, right, how that body moves, if that ankle is not able to properly, flex and extend, right, or move around, that's going to affect the knee typically. It's going to affect, the hip, could be affecting the back all the way up to the neck. So the ankle can be a really tough thing that if it's not addressed can lead to other issues down the line. So hopefully we can get to you soon. We'd love to get you into the clinic and take a look at it. But the ankle is a very common injury. And I spent about 8 years being as a part of the medical staff for Division I colleges. We get lots of professional athletes, a lot of high-end athletes coming through. And ankle sprains are extremely common in the athletic population. So that's probably one of the most common things that I treated, especially in the athletic population. But again, it could be a ski injury, can be, having a funny step off of a curb. And typically what happens is as we sprain that ankle, we have an injury like that. A lot of times we're more prone to have injuries down the line because, again, those ligaments get a little stretched out. They get a little loose, which means that the ankle could have what we call laxity. It's a little extra stretchy. And so what we can do is, again, this is the benefit of ultrasound because there's so many structures in that small area, right? Hands and feet, tons of anatomy in that area. We can really pinpoint now and diagnose where we think that issue's coming from. So I'd love to get you in the clinic and take a look at you, Mark. That's fantastic.
Well, I'm looking forward to it. I've been kind of putting up with the pain in my ankle for about 3 to 4 years now since I had that ski accident. And when I first had it, it was really bad. And but with some chiropractic adjustment, it's gotten a lot better. And now I'm down to where I don't have any real pain with it most of the time, but if I spend all day on my feet, if I go to Disneyland or just do a lot of walking or hiking, then it gets to the point where the ankle is just blowing up like a balloon, and I'm in, I wouldn't say a lot of pain, but it's definitely uncomfortable.
Yeah, it can be something that limits you a little bit. Yeah, and again, like I said, a lot of times when you have that initial injury, again, you're more likely to, further injure that area down the line. So we'd love to break that cycle, right? Get a little inflammation in there with these cells, get some healing going. You got to do a short period of offloading that area, and hopefully get you back to action here, Mark. So I really appreciate your call. Thank you so much. And again, another great example here of how we can use regenerative medicine to heal injuries. So you mentioned he had a rotator cuff injury. It's, one of the most common things that I see in the clinic. Someone has shoulder pain. And they think maybe they have some arthritis. They get an x-ray, which again doesn't really show a rotator cuff now, right? Rotator cuff's a soft tissue structure. X-ray is good for things like bones, so we're ruling out things like fractures and dislocations. But in terms of the soft tissue now, that's where ultrasound is such an amazing tool, higher definition than MRI. And again, for me, I get way more information from that ultrasound, especially for rotator cuff tears. A lot of times we can find things that aren't showing up on MRIs because it's dynamic, right? Ultrasound is dynamic. I can move the body around as I put my probe over that tissue, meaning we can kind of put some stress on it. If I have a really little tear, we can put some stress on it or have the patient activate that tissue, right? Trying to maybe use that muscle. That can reveal a lot more information for us. And it's a very superficial structure. I can use very small needles and really pinpoint exactly where that tear is, introduce some cells to that area, get some healing going. So that's the break here, guys. Again, we'll go to the break. Make sure you give us a call here. Our number live in the studio, 866-870-5752. Call us live in the studio, 866-870-5752. Free consultation over the phone with our office staff, 800-300-9300. That's 800-300-9300. Our website, www.jointrehab.com. See you after the break.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.